Hello, everyone. I'm Patrick Wade with the Champaign County Joint Information Center, another daily video update to keep you informed. Today, we are with Dr. Nigel Goldenfeld, Center for Advanced Study Professor in Physics, and Dr. Sergei Maslov, a Professor and Bliss Faculty Scholar in the Department of Bioengineering, both with the Grainger College of Engineering at the University of Illinois at Urbana-Champaign. They've done some work into modeling what a stay-at-home order can do for our community and our state. So we wanted to talk with them about that today. Sergei, I'll start with you. So you were asked to consider 3 different scenarios in this model. Can you tell us about what those scenarios were and what have you learned about how social distancing and stay-at-home orders can influence the spread of COVID-19?
Sure, Patrick. So Nigel and I are members of the modeling team convened by the Governor of Illinois. Apart from our team, which is based at University of Illinois, there are also members of the team based at the University of Chicago and Northwestern University. And the Governor asked us to consider 3 scenarios. One in which the stay-at-home order was never issued. Another one, which is sort of a baseline scenario, things as they are right now. And in this scenario, the stay-at-home order would continue for the duration of the simulation. And the last one, the third one, was when the stay-at-home order, if it would be relaxed, and since we were doing our presentation around April 23rd, so we were asked to consider what if it would be relaxed tomorrow on April 24th. Our team, as well as 2 other teams, are studying mechanistic models of the spread of the epidemic. And they are different from just fitting the curve and trying to extrapolate the curve in the future. The advantage of using those mechanistic models is exactly that they allow one to consider those hypothetical questions. What if the stay-at-home order was never implemented? What if it would be relaxed, and so on? Of course, you know, there are some degree of uncertainty, which we'll talk about later. But basically, the main message we learned from analyzing the results of our model is that if social distancing was never implemented, the results would be much, much worse than they are right now. In fact, the main factor which slows down the COVID-19 dynamics in the state, and not only in the state, in the whole world, is this social distancing as practiced by the citizens of different countries or people in our state. So we, for instance, estimated by comparing the death numbers in the scenario when the stay-at-home order was never implemented and our baseline scenario, we predict that the number of deaths would have been 20 times larger if the stay-at-home order was never implemented. One disclaimer here is that we cannot really distinguish between what people do on their own to social distance and what they do by following governor's orders. In other words, our scenario in which social distancing was never practiced considers this hypothetical case if nobody really watches TV or reads newspapers, and just proceeds exactly as they were at the start of the epidemic in early March. And back then, the number of cases, COVID-19 cases in the state were doubling every 2.5 days. So just extrapolating this doubling rate in the future and predicting how it would be behaving as a function of time, we were able to make those estimates. The other point I wanted to make is that mathematical modeling, especially mechanistic mathematical modeling, allow you to see or measure some of the things which we cannot really detect due to insufficient testing and so on. In particular, we can estimate the number of infected people in the state and in different regions of the state. And this number would be much larger than the number of cases reported daily on the IDPH website, for instance. And this is the main number which one should watch when any decisions about relaxing social distancing or relaxing stay-at-home order are considered. So if you relax prematurely, as we did in the 3rd scenario of our model, the number of cases would skyrocket again, and the only number which tells you what is the current state of the epidemic in the state is this number of infected people. That's the most important number.
Okay, thank you. I'll go to Nigel next. So Sergey kind of touched on some of the unknowns that are involved in all of this. So when you spoke at the governor's briefing the other day, you mentioned some of the challenges of trying to model this. What are some of those challenges, and what are the difficulties in trying to gauge where we'll be 2 months or even 2 weeks from now?
Sure. Well, I'd say there's three main challenges to modeling an epidemic: data, data, and data. So this might come as a surprise to some of the viewers, because you might assume that finding the right equations is the main difficulty, especially given how complicated it is. You need to model how viruses are transmitted in large populations. There's complex social interactions, variable health and pre-existing conditions of people. And of course, there's large variations in the population density throughout the state. So those are definitely modeling challenges, and they're difficult, but we know how to address them at various levels of approximation. And of course, all models are approximations to the truth. But if they're too detailed, then they have too many fitting parameters, and you can't make reliable predictions. If they're not detailed enough, then the predictions are not helpful because they're too uncertain. So what we try to do is devise models that are a good balance between these extremes. However, even once you've done that, you have to fit the model to the real world. And if you can't predict the past, how could you predict the future? So what you'd say is, well, what's the problem? We know the number of cases reported every day on the news, so you can just fit to that. Well, those data are pretty much useless because they depend on the number of tests you make and who you make them on. They're not random throughout the population by any means, and there's not enough of them. So what we do is we work backwards from COVID-19 deaths and the ICU patients and the non-critical patients in hospital, because those numbers are certain, and we know that we understand exactly where they come from, and we can get them in real time. So this has two benefits. These data are very well monitored, and by using them, what we're essentially doing is building a model of hospital utilization, and that can be used for healthcare resource planning. And we've worked with people here in Champaign-Urbana with the public health department and Carl Hospital and OSF. Now, the hard part is compiling all these data. And even though we work with the Illinois Department of Public Health and a data analytics company in Chicago, getting data that are reliable, complete, and federated, meaning everything is put together in a way that you can use, is very difficult. And we are still just finally managing to get access to all the data that we and the other modelers need. So the good news is that our models work well in fitting to those data, and they make robust predictions, particularly now that the epidemic is not accelerating as fast as it was a month ago.
Okay, great. And yeah, thank you for that. I think you said the other day, trying to model this is not rocket science, it's harder. So given those challenges, what exactly boosts your confidence in your version of this model?
Sure. So the models are robust. So what that means is this: we do these tests every day. We take data from, say, a week ago, and then we take our current model and we take the latest data. And then what we do is we say, let's pretend we were back in time a week or 10 days or whatever. What prediction would we have made then? And does it fit with what we actually saw? And the result is that, yes, the predictions hardly change. And in fact, the longest one we can point to is back in March. Back in the middle of March, we wrote a memo to the university, actually, and also then a few days later to the state. And what we showed was that if you did a stay-at-home order early, it would be very valuable in terms of saving the healthcare system and the number of deaths. And the argument is basically every country has had to implement a lockdown, because if you don't do anything, you are going to the deaths and so on are going to rise to such unacceptable levels that you'll be forced to make a lockdown of some sort. And we pointed out that if that's going to be the case, it's much better to do it preemptively rather than reactively after everything has got bad. And that was indeed was what was done in this state. And what we did was we only calibrated to death data. We made a number number of assumptions about parameters from other countries and so on. And what we predicted was that the peak in Chicago would occur on April the 22nd, 2020, which is and we assumed a certain level of mitigation had been enacted through some kind of stay-at-home order. And in fact, the peak occurred exactly when we predicted, although I would say that this is a coincidence. We're much more interested in the directional effects than the exact dates and the exact numbers. But as it happened, it was exactly that day for some reason. The thing is that we did assume that the stay-at-home order was more effective than it turned out to be. We didn't have any way to predict what sort of order would be made by the governor and how people would react. And so what we assumed was that the stay-at-home order would be slightly more effective. So the number of peak deaths and ICU that we predicted was lower than what actually happened. But this is consistent with mobility data from Google and others, which shows that our reduction in mobility is not quite as good as in other places. So we didn't flatten the curve perhaps as much as we had assumed in that early calculation. But the point is, the take-home message is that predicting based on these quantitative models is semi-quantitatively accurate. It gives you the right trends, and it tells you if you want to make a choice about what to do as public health policy, what are the options and what will be happening if you make one or other option. Now, the alternative to what we're doing is no model. And even a no model is a model. It's basically an extremely simple and bad model. It says, I don't need to write down equations and take into account data and do calculations. I'll just say what I want. You can just guess. So if, for example, you could, using that model, you can predict that in the month of April, COVID-19 will just go away, poof, like a miracle. And in fact, there are now over 1 million cases in the United States. It didn't go away. It didn't go to zero. So that was a staggering failure of prediction. So that was what happens when you don't use a model, when you just guess. So there isn't really an alternative. And the real question is having a good team of people, such as the group that we work with, where you can try to seek consensus, do ensemble forecasting, and give policymakers quantitative input that they can use along with other considerations, such as economics and public health policy, in order to make their decisions.
Sure. So it seems like the stay-at-home order has been successful this far. I'll turn to Sergei. So the model predicts that the number of cases will peak in Illinois in somewhere in May. So can you tell us what this means for our community and what we can do to make sure we stay on the right track to slow the spread of COVID-19?
Okay. I want to start my answer by saying that the prediction of the exact date of the peak is very uncertain. So it depends on many factors, including how people actually behave, whether they may preemptively start relaxing social distancing, which would be a very bad idea given how many infected individuals we have in the state. But I also want to reiterate on something Nigel touched upon, that one of the reasons why we have not one but 3 modeling teams is that each modeling team does the predictions independently, and we come with somewhat different dates of the peak. So it's not really an exact date. One of the factors which nobody really knows for sure for this virus is how strong are seasonal effects. Everybody knows that the flu is stronger in the winter time than in the summertime. We don't know for sure how it is for this particular coronavirus, even though we have some data for other coronaviruses, and we use this data in our model to approximately predict seasonal effects. Other teams do not use the seasonal data, and their peak comes somewhat stronger and later. So coming back to your question about what can we all do to make this peak sort of sooner, and how should we behave to after the peak? I want to reiterate on something which I said before, is that the peak of the epidemic is not the end of the epidemic. The peak is just actually, coincidentally, is the largest number of infected people in the state. So after the peak, you have to wait for a considerable amount of time until the number of infected individuals goes down to the levels where we can individually track and test them. So what really happens after we pass the peak and after this number of cases starts going down is we really need to ramp up our testing and tracking program. And I know that the state is thinking seriously about it, and the university is playing a large role in this. Some of the things which we cannot really infer from our model, but I believe that we have enough data now by just reading the literature, and is that face masks help. And the governor recognized it, and one of the sort of new parts of this extension of the stay-at-home order is that you should wear a face mask whenever you are close to other people. You don't have to wear it in the forest when you're alone, but if you're close to other people, you should wear a face mask. And that comes from two sources. One is that because we still don't know with any degree of accuracy the number of asymptomatic carriers. So anybody can, in principle, be a carrier. And wearing a mask, you are not spreading what you might have to other people. And second of all, even the simplest mask helps people not to get infected because it prevents large droplets from getting inside your airways. So again, wearing a mask is a good idea. Staying home whenever you have symptoms is a good idea. Just the standard messages which you hear from our excellent public health department over and over. So I'm not really an epidemiologist to repeat them, but.
Sure, thank you. So obviously good messages right there. Thank you both for joining us today and talking about a model developed right here in Champaign County. And a couple last resources we always want to touch on in these videos. ChampaignCountyCovid19.org is a website where you can go to get more information about local resources and the local response. And anyone out there who needs assistance in any way, needs to find resources, call 211. 211 will get you hooked up with a trained specialist who can find you that help. So again, Doctors Maslov and Goldenfeld, thank you for joining us today. Thank you for talking about your model, and thank you to our viewers for joining us today and staying informed.